This is Dr. JoAnn Manson, professor of medicine at Harvard Medical School and Brigham Women's Hospital. I'd like to talk with you about a recent report in the British Medical Journal on different forms of contemporary menopausal hormone therapy and risks of cardiovascular disease. This is a very large-scale and comprehensive study from Sweden that looked at more than 900,000 women, including more than 77,000 users of hormone therapy. The women were aged 50 to 58, and the study leveraged the nationwide register system where they have information on prescriptions, medications, as well as health outcomes that can be linked. And this study looked at different forms of hormone therapy, oral versus transdermal, estrogen, with and without a progestogen, and also tibolone, which is not available in the United States. And the endpoints included myocardial infarction, total ischemic heart disease, stroke, a composite of CVD, as well as venous thromboembolism. And what they found was that tibolone was associated with the greatest increased risk of CVD. There was actually an increase in both ischemic heart disease and stroke, as well as composite CVD. They did not see an increased risk of VTE. This may be related to the unique pharmacologic profile of tibolone, which has estrogenic, progestogenic, and androgenic properties. Now, the estrogens tested in the estrogen plus progestin formulations and estrogen alone formulations were not conjugated equine estrogen as tested in the WHI and hers, but actually mostly oral or transdermal estradiol. And with combination estrogen plus progestin, they did see a small, about 20% increase in ischemic heart disease, similar to what was seen in the WHI, and about a doubling in the risk of VTE, also similar to what was seen in the WHI. And with estrogen alone, no increase in ischemic heart disease or MI, but there was about a 50% increase in VTE, similar again to WHI. Now, with transdermal estradiol, transdermal forms of estrogen, in contrast, there was no increase or no clear increase in any of these CVD outcomes. And in fact, there was a borderline reduction in both myocardial infarction and composite CVD. So overall, this study suggests greater cardiovascular safety with transdermal compared with oral estrogen. This would be expected given the first pass metabolism, increased clotting associated with oral estrogens. Now, we know that based on a large body of evidence that for women in early menopause who have, say, bothersome vasomotor symptoms, and if they're healthy, really oral or transdermal estrogen could be used according to the preference of the woman. But this study suggests that, especially in women who do have cardiovascular risk factors, it may be very reasonable to lean toward the use of transdermal over oral estrogen among women who are choosing to use hormone therapy. We certainly need more research on transdermal estradiol and micronized progesterone and these contemporary formulations that are being used. But in the meantime, this study in the BMJ does provide very useful information for women and their clinicians. Thank you so much for your attention. This is JoAnn Manson.